You know, ladies, next time you call out to your man and he says he didn't hear you, he may not be lying. Studies indicate that men are twice as likely to develop hearing loss than women, especially those between the ages of 20 and 69. More than 28 million Americans have some type of hearing impairment, and roughly 60% of them are men. Paige Holt, Doctor of Audiology at LAKE ENT, explains why men are more susceptible to hearing loss.
There are many different things that can cause hearing loss. The most common would be aging and just degeneration of the hearing nerve. Noise exposure. Men who work in a factory around loud equipment, women can work around loud equipment as well. Family history can play a part, genetics, but we also can see some ototoxicity with certain medications that you take and certain drugs that are taken. Some of them are needed for life-threatening situations, and in those cases the physician who is administering that medication will refer the patient for monitoring to monitor the hearing over time as they take that medication to make sure that they're not losing a lot of the hearing. Anytime someone is working around loud equipment, working in a factory, it is regulated now that people wear hearing protection, and it's monitored by OSHA. A lot of people don't do that though, because they say, I can't hear my boss, I can't hear my coworkers, and so they sort of take their sound protection out, which can damage the hearing. So it's very important to wear hearing protection when you're working around loud equipment in a factory. A lot of people who are not in large companies, maybe they have a lawn company, a lawn service, and they're not monitored by OSHA. But they do need to be wearing earmuffs or earplugs to protect themselves from the loud equipment. Hearing loss can be genetically related, and so we always would recommend that if you do have a strong history of hearing loss in your family members, that you do start having your hearing screened in your middle years, because we want to know what your hearing is, a baseline, so that if you do have something happen, we can have a hearing test performed and we will have a baseline to compare it to so that we can determine, is your hearing starting to progress? Is this just an episode that we can treat medically and have it recover? Or are we starting to see some aging?
Hearing loss among the male population might be caused by a single factor or a combination of factors. Common contributors to hearing loss in men include genetics, age, exposure to loud noise over a long period of time, diseases such as meningitis, diabetes, and cardiovascular issues, ear and head trauma, earwax buildup, and ototoxic medications. These are drugs which have an important purpose but may also have an adverse impact on their hearing. The audiology team at LAKE ENT has offices in Leesburg, Tavares, and the Villages. For appointments and more information about hearing aid and audiology services offered at Lake Ear, Nose, Throat, and Facial Plastic Surgery, click the Male Hearing Loss story link on our homepage at yourhometownhealth.com.